Yeah, thanks for the kind invitation for this small interview being held during the EANS ISIN conference in 2023 in Verona. Well, my name is, as already said, Professor Szelényi. I'm a neurologist and I'm in the field of intraoperative neuromonitoring for more than 20 years meanwhile, so it's really quite a long time. And I am working at a department for neurosurgery. Currently, I am located in Munich, Bavaria, Germany, and 90% of my work is within the neurosurgical department, but I also offer service for the orthopedic, vascular, and ENT departments, and we are always exploring new fields into different and other disciplines. For example, like radiology, if they request monitoring, I'm always willingly to serve. Well, okay, I'm very lucky as I am working with 3 technicians who are all trained in clinical neurophysiology, and so they receive further education in specific for intraoperative monitoring. Basically, it's a training on the job, and attending German-based conferences and educational programs. But clearly, this is something we also have to extend for other technicians. Indeed, interest is really growing, and so we are an interdisciplinary field. So we need to understand the neurosurgical procedures. We need the neurophysiological backgrounds, the neurology backgrounds, as well as anesthesia and technical backgrounds. And we are on the verge that we have to fuse more and more in order to have an exchange and in order to develop the field. So especially our neurosurgical colleagues are basically requested to have more ideas where they might use intraoperative neuromonitoring, so we can extend and develop into future fields. There are new techniques emerging, like local field potentials, like resting state MRI, and more direct cortical recording, cortical evoked potentials, axonal evoked potentials. All these fields we only can improve and develop if there's interest from the neurosurgical community. On the other hand, there are a lot of methodologies already established, and we need more support by the means of data evaluation, data analysis, and I also think that it is a task of both the neurophysiologists and the neurosurgeons to develop more guidelines and standardization, which will for sure have an impact into medical legal questions, so that there is still the opportunity for everybody to perform within their own medical understanding how to treat patients. But on the other hand, we all talk about setting up new quality standards, and I think this is the more administrative kind of work we have to do. Well, we are a very technical field, no doubt. And although the relation between medical doctors, hospitals and the industry is very much on the focus, under focus of everybody, so that it has to be within the rules of compliance. But on the other hand, we need each other. If you're in a technical field, you need the development of machines. You need the development of new techniques to evolve emergent fields. So we have to find, on one hand, a medical legal compliance system, which has to be developed. On the other hand, I think we need the industry in order to implement artificial intelligence, to have more access to large databases, in order to have access to analysis, automatic analysis, and then, as always, on the basics of new ideas, we have to develop in very small scales in the beginning new techniques, which then we can implement in phase 2 studies, probably even with the modern medical device regulation settings, especially in Europe. And then also we need also to improve our knowledge in evidence-based studies. We need to improve it in phase 3 studies.